Good afternoon. My topic is on turbidity of cyst as a biomarker and association with systemic comorbidities in center involving diabetic macular edema. Diabetic macular edema is the most common cause of visual impairment in patients with diabetes mellitus, and it represents an accumulation of fluid within the central portion of the retina, which arises as a consequence of failure of blood-retinal barrier. These are the OCT patterns of macular edema. First one is cystoid macular edema, second is spongiform edema, and the third is neurosensory detachment. Turbid cyst is defined as cystoid spaces completely or partially filled with grayish, irregular, hyperreflective material without backshadowing in the OCT B-scan cross-sectional images. Our aim of the study, systemic correlations of center involving diabetic macular edema patients with turbid appearing cyst and with non-turbid cyst, and to evaluate the associated OCT characteristics in turbid appearing cysts like central foveal thickness, hyperreflective foci, and disorganization of inner retinal layers. Materials and methods. It was a cross-sectional study period from January 2022 to January 2023. 101 eyes of 70 patients with center involving diabetic macular edema is selected and is divided into two groups, group 1 containing turbid cyst and group 2 containing non-turbid cyst. And we included patients who are diagnosed with center involving diabetic macular edema, and we excluded vitreomacular interface abnormalities, glaucoma, other retinal or optic nerve pathologies, and previous history of treatment for DME. And baseline data collection include gender, type of diabetes, duration, severity of diabetic retinopathy, other comorbidities, and ophthalmological evaluation like best corrected visual acuity, fundus examination, and spectral domain optical coherence tomography. And OCT parameters we included central foveal thickness. We measured the vertical distance from the internal limiting membrane to the outer border of the retinal pigment epithelium using the caliper tool. And hyperreflective foci will be defined as the presence of small hyperreflective particles that are scattered throughout the retinal layers, which are formed due to the accumulation of proteinaceous material or activated microglial cells. And disorganization of inner retinal layers is defined as a horizontal band for which any boundaries between ganglion cell, inner plexiform layer, inner nuclear, outer plexiform cannot be identified. And going to results, 51 eyes of 35 patients were included in group 1, turbid cyst group, and 50 eyes of 35 patients were included in group 2, that is non-turbid group. And overall, the grades of diabetic retinopathy, moderate non-proliferative diabetic retinopathy is the most common one. And the comorbidity distribution of the enrolled patients, most common comorbidity we found out is the hypertension. And distribution of hypertension across the study groups. Hypertension in the first group was 60% and in non-turbid group it was 43%. And chronic kidney disease was also more in the turbid cyst group. And dyslipidemia we found almost 50% in both the groups, and we found no association. And HbA1c, it was more 8.2 in the first group, and non-turbid group it was less, and with the p-value significant. And central foveal thickness is also more in the first group, and second group it was less. And other OCT parameters like presence of drill, hyperreflective foci were almost 55% in the group 1 with significant p-value. And coming to discussions, our observation, individual with turbid cyst had poorer glycemic control, longer duration of diabetes mellitus, presence of hypertension, chronic kidney disease as comorbidity, and poorer vision. And our studied 51 eyes of 35 patients with turbid cyst, and we found association with hypertension and chronic kidney disease, and we found no association with dyslipidemia. And OCT parameters were also more in the turbid cyst group. And the similar study conducted by Ramesh et al., they also noted OCT parameters which are hyperreflective foci, ellipsoid zone defects, and central retinal thickness were more in the turbid cyst group than non-turbid cyst group. But they didn't find any association of medical conditions like hypertension, renal, or cardiac disease. Study conducted by Cotter et al., they studied 33 eyes of 24 patients with turbid cyst, and they found severe NPDR is the most common retinopathy noted. And study conducted by Arthi et al., they also studied 131 eyes of 91 patients, and they observed a higher prevalence of hypertension and lower serum triglycerides in the group with more hyperreflective foci. And take-home message, turbid cysts are commonly observed in patients who have concurrent conditions such as nephropathy and systemic hypertension. And turbid cysts often indicate a poor visual prognosis for patients as they are frequently associated with presence of drill. It is a ischemic marker. And the presence of hyperreflective foci, which is an inflammatory marker in the turbid cyst, suggests that corticosteroids may be more effective treatment option than anti-VEGF. This finding could potentially lead to modifications in the treatment approach. These are my references. Thank you.
What actually causes the turbidity in the turbid cyst?
It's a most chronic cases we observe turbidity, and we found that associated comorbidities also indicative of
Yeah, but
turbid cyst.
anything in the literature about, you know, what material is accumulating in the cyst?
No, ma'am. It's a hyperreflective material. It's like no other studies are.
Okay.
No.
Okay. I also found it interesting, you know, in that, you know, I was just thinking to myself, might be used as a biomarker for deciding on the treatment strategy.
Yes,
So, at any studies you quoted a few papers, you know, does steroids work better in this?
Yeah, steroids work better.
Yeah.
But we found but it is contraindicated in increase IOP, cataract, and all. Then anti-VEGF will. Yes.
Were all your 70 patients first time visits? They had no treatment before, or how did you?
No treatment before.
No laser, no injections.
No injections. No laser.
You made sure that they
Yes,
were.
yes.
Okay. Thank you.
Thanks.